I'm Dr. Msanji Geoffrey. I am a member of the Uganda Medical Workers Union, which is an affiliate under a private sector foundation. I'm here to talk about the issue of gender-based violence amongst health workers. And all I will say is that gender-based violence is a cross-cutting challenge that is actually disturbing very many or challenging very many individuals in the health sector. And all we can see is that in general, it's a challenge that actually it goes unnoticed, that people actually never talk or they never present out the challenges. But there are a lot of challenges that they go through. We have cases of those because of the work shifts that they go through. Those who work night shifts, for example, they're normally challenged, especially when maybe probably there is a power load shed at the facility. They have a challenge of some individuals actually tasking them or challenging them through the night, trying to do some bit of violence onto them, which may start from simple action probably of sexual harassment. And once probably someone resists because they really want to show that they are on duty and doing their work, an individual actually decides to actually go violent. We've also seen a challenge that a good number of these individuals, especially in this time of the COVID-19, but there are special allowances that have been put in place, but we find that this is actually not done in a very fair manner. Some of the individuals actually discriminated, and that poses a very big challenge. Now, when it comes to GVB in the health sector, yes, I will say that some workshops were held in various facilities, but this just ended on the little maybe training or sensitization that was done. You find that putting in place structures was not done. You find that it all ended at that point. And you find that when people actually challenge, they actually fear to open up because there's no clear desk that has been put up to help these individuals actually do something. So I would actually think that on part of us as the union, it would be important for us to create more and more awareness and even create a better platform for our dear workers to actually be able to air out their views. And it is at this juncture that I even address the issue of the Convention C-190 of the International Labour Organization. This is a convention that really talks about and addresses issues concerned with gender-based violence and harassment at the place of work. This should be taken as a very serious concern to actually help us move on. Government should actually come in even with better ways and better structures in place to ensure that actually we have a clear reporting mechanism that can enable them actually to have issues in this line clearly handled and addressed. So we can see that the issue of C-190 and advocating or pushing for it to be ratified by our country will move a milestone in trying to ensure that issues of gender-based violence and related harassment is actually eliminated in the health sector.
Good morning, comrades. Akech Mary Gloria from National Union of Educational Institutions. I am the National Secretary for Women Affairs. In my department, we are gender sensitive, whereby I'm the chairperson of the Women Affairs, and my secretary so happens to be a male who is the youth leader. We are in charge of all educational institutions, government educational institutions. Those are the government universities, the colleges, and primary schools. Primary and secondary, we deal with the bursars, generally the support staff, not the teachers. To deal with gender-based violence is something that is recurrent. It can be a one-time act that is impacted onto someone to bring pain, to bring torture. It can be psychosocial, it can be physical, or it can put something, it can impact you, something that is long-lasting. In educational institutions, we have very many samples of GBV. We have, for example, most support staff are being sexually harassed, looking for promotions, looking for retainees at their jobs, and working, getting good payments like overtime, so their bosses tend to harass them. In my overview, I think the government has kept silence to as in to ratify the C190. It would help us to go down to the grassroots, educate the people about gender violence, gender-based violence. People would get to know their rights and fight for their rights. In education institutions, we have departments that is gender mainstreaming, where policies are passed, and actually in universities, policies have been passed how they should handle gender-based violence. But it's only that the measures of where to report to, how a person can access in case of help, in case of torture, someone is mentally disturbed at the place of work. For example, we have bosses who even reach an extent of abusing you, that is stereotyping you, you're mentally disturbed. They call you at awkward hours at your place of work. That is really a big challenge at the universities. We have promotions. People at universities, the lower cadres, need to be promoted because they have actually acquired more and more qualifications. But you have to exchange something, and it is mostly sexual. During this pandemic, people have been taken up for granted. Somebody leaves you to work at your home, no overtime is paid, they don't pay for your bills, they don't care about you. But I believe the C190 defines a home as a workplace. I call upon all the stakeholders to put in hands to ratify the C190 so that we have a fair and a running nation.
Audio